This is Dr. Jerry Hesch. I am an orthopedic manual physical therapist, which means I treat joints throughout the body, I treat the nervous system, and I treat patients within a biopsychosocial framework. My client presents with pretty severe left pudendal neuralgia and a lot of sensitivity in this area in the intimate portion of her anatomy. And how long have you had that?
The pudendal and the intimate area for a little over a year, about a year and a half, and the ischial tuberosity area that bleeds into that sciatic has been since June the 4th. It will be 4 years. June
Oh my.
4th. Yeah.
Oh my.
Yeah.
And what was the cause of these symptoms?
Well, number one, I don't have a factory spec pelvic structure due to the motorcycle accident, severe motorcycle accident I had many, many years ago when I was 34. And then I was making a bed. I had an incident where I was making a bed, had my foot on the bed with the mattress on the knee, as you might imagine putting a fitted sheet on a mattress, large, huge mattress. And the bed frame was not attached to the bottom part, and it went down suddenly. The mattress slammed down on my foot. I felt a popping, tearing feeling right at the. We thought it was torn hamstrings for a long time.
And the MRI negated that, am I correct?
In the what?
The MRI negated it?
Oh, yeah, well, and everything else, because
Okay.
of all the doctors I've been to. The physical therapist that I told you about yesterday said this is something else. It's got to be connective tissue. It's got to be something, I don't know. And
Okay.
yeah.
And what we found yesterday was that thing that we named sacral torsion. And maybe a sacral torsion is the whole pelvis being twisted. Some people say it happens in the SI joint, some say it doesn't, and no one's done a good motion study pre and post, but you were prominent on the right lower quadrant of the sacrum. It was lower on the ILA. You had blocked motion when I tried to spring.
Right.
That's been restored. I cannot spring that easily.
Oh, sure
This has been restored. Your tailbone was side bent to the left. That has been restored. The sulcus on both sides is now symmetrical. But today what we find is that really subtly this ischial tuberosity is more lateral, okay? And no, it's not subtle, it's pretty apparent. And when I try to induce passive spring, I can take up the slack in the body. You can see the pelvis moving over to the right, so there's motion in the lumbar spine, okay? But at that point, I can't get normal spring mobility. Okay, I can do that in different directions. I can get upward spring easily, but not left to right, and that's true on both sides. And then also I can't get any right to left motion once I take up the slack in the system. Okay, so this is a pattern that I call lower windswept pelvis, and how much of that happens inside the SI joint, we don't know. There's only a small amount of movement in that joint. Maybe a little bit of that happens in there. I'm checking the tone of the sacrospinous ligament, okay, and I can't detect any difference. Yesterday the right one was hypertonic and prominent. Today they seem rather equal. The sacrotuberous ligament is right here, and that feels like bone. Okay, I can't indent it. This sacrotuberous ligament is a very distinct structure. I can indent it. I'm springing with my thumb. I don't know if the camera angle can see that, but I can perceive a little tiny spring in that. But this is so tight here, and so that's interesting.
And I can feel that distinctly.
You can feel the difference.
Yes.
Well, the pudendal nerve has this tortuous route and branches off and so on. It's worth looking up on you know, an anatomy textbook or online, whatever. But it does go between those two ligaments. Okay? So when one of those ligaments is abnormally tight due to a positioning of the pelvis, then that certainly can affect that ligament. And I have had people with severe pudendal neuralgia get much better when we reduce a side bent tailbone and when we reduce this windswept lower pelvis. I have a couple of case studies up on YouTube. My last name is H-E-S like Sam, C-H, and then you could use the key term pudendal neuralgia, and you'll find some of those videos. So what I want to do is work through your hips to get the pelvis to straighten out, okay? And so what I'm going to do, the way that I'm going to accomplish that, is that I'm going to externally rotate the left hip for 2 minutes. I'm going to internally rotate the right hip, okay?
Yeah.
Then I'm going to stretch the right hip outward. That's called abduction, okay? I'm going to stretch the left hip over to the right, and that's called left hip adduction. And I'm going to do all of those for 2 minutes. And so I'm going to stop filming now, and we will then test. Then we will then see how you feel in walking and in sitting, and whatever other stressful things you do that provoke the pain. We'll test those as well.
Perfect.